Welcome to today's module, The Last Visit, Death Confirmation and Coroner Notification. This short training will serve as a complement to your hands-on training. In this session, you'll review the essential steps in assessing vital signs that indicate life status. We'll cover how to properly check pulse, respiration, level of consciousness, and pupil response, specifically in the context of a death pronouncement. We'll also cover the legal importance of coroner notification, focusing on what circumstances must be reported, and your role as the hospice nurse at the final visit. When confirming death, we focus on 4 essential vital signs. Pulse assessment tells us about cardiac activity. Consciousness evaluation helps determine neurological function. Pupillary response indicates brainstem activity. And respiratory assessment confirms the presence or absence of breathing. Together, these 4 indicators provide a comprehensive picture of life status. Let's begin with pulse assessment. The pulse tells us the rate and rhythm of the heart and its strength. A normal adult pulse is between 60 and 100 beats per minute, though factors like fever, stress, medications, and underlying conditions can shift that range. Athletes or highly conditioned individuals may have resting heart rates as low as 40, and that can still be normal. It's important to keep context in mind, especially if the patient is in an active dying phase. When performing a pronouncement, utilize one of 2 points to check for a heartbeat. First, the apical pulse, that's located at the 5th intercostal space, mid-clavicular line on the left chest. Use a stethoscope to listen for heart tones. The alternative site, the carotid pulse, is located between the trachea and the sternocleidomastoid muscle. Use the pads of your index and middle finger and gently palpate for 10 to 30 seconds. If no pulse is detected in either location, and there are no signs of respiration or consciousness, you may begin to confirm death. Next, assess level of consciousness. In the presence of family, it's essential to use subtle, respectful techniques. We recommend using nail bed pressure or a hand squeeze. These methods can be done quietly and with minimal disruption. Other methods, like a sternal rub, trapezius pinch, or supraorbital pressure, although clinically appropriate, may not be suitable in front of loved ones and should be used with discretion. Pupillary response offers a clear indicator of brainstem activity. When exposed to light, a living person's pupils will constrict. This response is both direct, in the eye receiving the light, and consensual, meaning the other eye responds too. Check both eyes independently, shining a small flashlight from the side and observing the pupil's response. This simple test helps confirm whether neurological activity is present. During a pronouncement, pupils should be fixed and dilated, meaning they do not constrict when light is shown into the eye. This is one of several signs indicating death. If any pupillary reaction is observed, you should reassess the patient's other vital signs before proceeding. Be methodical and gentle. This can be a very sensitive moment, especially with family nearby. Respiratory assessment is not just about whether the patient is breathing. It's about the quality of that breath. You're evaluating elements like rate, depth, rhythm, effort, and sound. A healthy adult typically breathes between 12 and 20 times per minute. During active dying, this may slow, become irregular, or stop entirely. During a routine assessment, you would listen for abnormal breath sounds, such as wheezing, crackles, or absence of sound. You would also note whether the patient appears to be using accessory muscles, which would suggest increased work of breathing. During a death pronouncement, it's best to observe chest movement first. Then auscultate the lungs for a full 30 seconds per side. This extended period helps you avoid confusing gastrointestinal activity for breathing. Bowel sounds can be misleading, especially in a quiet room. If no breath sounds are heard and there is no chest movement, you may confirm that respiration has ceased. Once death is confirmed, the next responsibility is to notify the coroner. By law, coroners must be informed of every death in their county. The time of death will be reported as the time that the vital sign assessment is completed. In most hospice cases, this notification is routine and results in no further action, allowing the nurse to call the funeral home to retrieve the deceased. But some situations demand a more detailed report, and possibly an investigation if deemed necessary by the coroner. As hospice nurses, we understand that each patient's decline follows a unique trajectory influenced by many factors, chiefly their diagnosis and how it progresses. For example, we generally expect patients with congestive heart failure to have a longer life expectancy than those with stage 4 cancer. However, if a patient with a terminal cancer diagnosis passes away and we're aware they had a fall, especially one that resulted in a hip fracture, even weeks earlier, that information must be reported to the coroner during the death notification. The fall may have altered or accelerated their expected decline, potentially contributing to an earlier death. It's important to note that hospice nurses are not responsible for determining whether the fall contributed to the patient's death. Our role is simply to report relevant information so that the coroner can make that determination. Always consider whether non-natural factors played any role in the patient's death. Other examples include medication errors, overdoses, or missed doses. Trauma, even from long ago, that caused lasting complications. Vehicle crashes, suicide attempts, or any suspicion of neglect or violence. Keep in mind, it is important to not just consider the event, but its impact. When you're unsure whether to report details or not, err on the side of sharing. As we noted, our job is to provide the relevant facts. Therefore, it's better to over-communicate than to inadvertently withhold something critical. Now that your assessment has been completed, the coroner has been notified, and post-mortem care has been provided, the body can be released to the funeral home once the family is ready. This is a time of deep transition for the family. Your presence, professionalism, and empathy offer reassurance during this difficult moment. To close, here are your main takeaways. Use clinical, respectful technique when confirming death. Focus on pulse, respiration, pupil response, and level of consciousness. Know what details must be reported to the coroner. Keep the family's emotional state in mind throughout the visit, and above all, continue to lead with compassion and clarity. Thank you for your continued dedication to high-quality hospice care. Your presence matters.